Hi everyone! So for today, I will be demonstrating about antenatal abdominal examination, Leopold's maneuver, and auscultation of fetal heart rate. Step 1. Check the order for procedure and for nursing care plan. Step 2. Gather equipments. Measuring tape, Lennard stethoscope, antibacterial hand cleaner, and draw sheet. Step 4. Explain the procedure to the woman and rationale for each step as it is performed. Good afternoon po. Ako po si Student Nurse Ayla. Pwede ko malaman ninyo? Kisha. Sige po. Ngayon po is magpa-perform ako ng Leopold's maneuver or i-assess ko po yung abdomen mo para po malaman ko po yung position ng baby and yung palagayan po ng dito sa inyo po. 5. Instruct the woman to empty the bladder. So, ngayon po, pwede po kayong mag-empty ng bladder niyo or hindi naman po kayo sa bladder. Antayin ko po kayo dito. 6. Draw curtains around the bed. 7. Perform hand hygiene. Position the woman for examination. Place the client in a dorsal recumbent position, supine, knees flex. Place a pillow under the client's head to provide comfort. Then place a small pillow or a folded towel under the right hips of the patient. Have her arms on her side. Then drape the woman with draw sheet and expose the abdomen below the breast to the symphysis pubis. Nine. Inspect the abdomen for the following: scars, diastasis reti, hernia, linea nigra, stratae gravidarum, contour of the abdomen, state of umbilicus, and skin condition. Expose her abdomen from below the breast to the symphysis pubis. Then, inspect abdomen for following: scars, diastasis reti, hernia, linea nigra, stratae gravidarum, contour of abdomen, state of umbilicus, skin condition. 10. Determine the fundal height using the ulnar side of the palm. 11. Measure fundal height using the measuring tape. Perform Leopold's maneuver. 12. Instruct the woman to relax abdominal muscle by bending her knees slightly and by performing relaxation breathing. I-relax nyo lang po yung abdomen nyo ha, tapos i-bend nyo po konti yung knees nyo. Tapos, hinga po kayo relax lang po kayo ng paghinga. Okay? Rest your hand on the woman's abdomen while reinforce the explanation given earlier. 12. Warm hands by rubbing both palmar surface of your both hands. Relax lang po nyo yung abdomen nyo, ha? Apply smooth and gentle deep pressure as firm as necessary. First maneuver. Stand at the woman's side and face her. Palpate the fundus using both hands. Curve the fingers around the top of the uterus and feel for the fetal part lying in the fundus. Use the palm, palpate for size, shape and consistency, and mobility of the fetal part in the fundus. Second maneuver. Place your hand on either side of woman's abdomen about midway between the symphysis pubis and the fundus. Move your hands to the sides of the abdomen with one hand in place to steady the uterus. Use the other hand to palpate the opposite side of the uterus with firm, circular motions. Third maneuver. Continue facing the woman. Grasp the portion of the lower abdomen immediately above the symphysis pubis, between the thumb and middle finger of one of your hands. Maneuver. Fourth maneuver. Face the woman's feet and place the palmar surface of your hands on each side of the woman's abdomen. Use both hands and palpate fetal head using pressing downward gently with your fingertips about 2 inches inguinal ligament. 27. Place the pinard over the convex portion of the fetus closest to the anterior uterine wall. 28. Listen by pressing firmly and very gently, and count for full minute without holding the pinard, while the other hand feel the mother's radial pulse. Inform the woman the findings. Then 30. Tidy the woman's unit. 31. Wash hands. Then 32. Document findings and remarks if any.